Hi, everybody. I'm really excited to introduce you to someone special today. Jahni Hawkins is up in Port Macquarie, and she works for a magnificent clinic, and it's called Port Medical Aesthetics, and a well-known business and quite a prestigious one up there in Port Macquarie as well. Hi, Jahni. How are you today?
Good, thank you. How are you?
Yeah, really well, and really well. And thanks for sharing a little bit of your time with me today. It's lovely
That's
to have
okay.
you. Yeah, we've been working together for the last 3 or 4 months, getting to know each other and also having a bit of fun doing our Spend Suasion program. And there's many things we can talk about, but just so for the benefit of those listening, Johnny, may I ask you, what were some of the struggles or challenges that you were experiencing before you started the program? You were telling me in the very early days some of those challenges. What were they?
Yeah, so I guess probably the biggest one was when we got in our new machine, some of our prices went up and our patients weren't used to kind of spending that amount in one lump sum.
Mhm.
So being able to kind of navigate and kind of finishing that like sell or whatever you want to call it back then in the room was kind of a bit more challenging to try and
Right.
find the
Okay.
right wording to,
Yeah.
kind of get them across that line.
Yeah, and if I remember, you were saying you felt a bit awkward around that as well.
Yeah, it is awkward because it is such a large amount of money that you're kind of like,
Mm,
oh, yourself.
yeah,
So
yeah.
being confident in yourself to then, I guess, sell it to someone else to then spend that money, it can make it challenging.
That's a very common thing, in our industry today, because there's lots of new devices coming out and prices are moving up. And, it's as we've discussed during the training, it's all about value, not so much price. But
Yeah, yeah.
it's the problem you have or had is a very common one. So, which is thanks for sharing that. Then we had an opportunity to work together in doing our Spend Suasion course. We did 1 week at a time over the course of 4 weeks. The first week I came up and actually met you all, and we did it all face to face, and then the rest we did on Zoom. What were some of the things that jumped out? What were some of the things that you learned, and how has it changed your day to day?
So there's a couple of things that I think have stuck out to me. One of the ones was trying to change kind of the mindset to more of a positive one from the get-go when first meeting the patient.
Yeah,
So
yeah, yeah.
getting the 3 yeses, which is what
Yep.
we learned. So, and that, like you said, could be literally anything, checking that it's their name if they're a new patient. So, hi, is your name Jess? And then they'll say yes. Trying to navigate having that to try and change the mindset. I found when I first kind of heard, I was like, oh, that's interesting. I'll give it a go. It kind of sounds almost too good to be true that would then
Mm,
change
mm.
the whole outcome, if that makes sense. But
Yep.
surprisingly, it did. So I kind of stuck to it. I'm still doing it.
Good on you.
And I've got a bit more creative with my questions
Good,
rather than
good.
kind of just sticking to the few now that I'm a bit more comfortable with um, the techniques, if that's
Yeah, the process.
yeah.
Yeah, yeah, yeah.
So that
Okay.
was one of them.
Mm-hmm,
The
mm-hmm.
other ones was buying signals,
Yeah.
which was a huge one, was kind of, which is what gave me confidence to then sell the bigger sort of treatments, if that makes
Yep.
sense. Being able to go, oh, hang on a minute, that's a buying signal,
Mm-hmm.
going, okay, now navigate the conversation accordingly rather than shying away
Yes.
where I'd probably normally would, going, oh, they're asking questions. It's a
Mm-hmm.
pushback, not a
Yep.
they're
Yeah.
interested for more, if that makes sense.
Yes. Yeah.
Yeah.
And again, it's something that, and I joked with you in the very beginning when I said, once you see these once, you'll see them all the time. And it's
Yeah.
amazing, isn't it, how they just pop up now?
Yeah.
In that example that you used, I see that so often when patients start asking questions, it's misinterpreted and the therapist retreats
Yeah.
rather than engage. And as we've said, if we just treat those a little bit differently, you get a big different result. That's lovely. Thanks. Was there anything else on the list for you?
Um, the other one was kind of, I can't remember the terminology that we
Oh,
used, but it was
that's okay.
more in terms of how we word certain things to be able to get the response that we're after.
Yes. So when we were talking about reaching an agreement,
Yes, yeah. So
yes, there are
like
different ways
how
to do that. Mhm.
yeah, which again, I've kind of found my groove now, rather than just sort of, so in the beginning, obviously I was really kind of sticking to the examples you had given us.
Yep.
But now that I'm a bit more comfortable with it, I kind of, it flows more, if that makes sense. I can't even think of an example to give you, because I just make it flow within the consult, or even to try and, you know, like level up, you know, there you go. There's one, level up, extend, exceed, all those sorts of things to kind of continue on with their skin journey, I guess.
Yeah, and it's like anything. It's like anything that we learn for the first time, or anything we learn that's new. It takes us a little bit of time just to get it in the groove. And then once we own it, then we get into the flow, and then it just happens naturally. And that's where you're at now, which is really great, which was very exciting. And retail was also, I think, was an area that went quite well for you too.
Yeah, so normally I am retail background. So coming from that and trying to use a different perspective, I guess, in, I guess, again, terminology, using home treatments rather than products, to try and, I guess, trigger those positive things in their brain rather than going, she's trying to sell to me.
Yeah.
So I've noticed a difference in how it's easier to reach that agreement with the products rather than just doing it my retail way, if that makes sense.
Yeah, and again, all we're wanting to do is differentiate ourselves from that way that in the past people also associate with a bit of pressure, where what we've been talking about is making it very client or patient centric, meaning we're focusing on them, not so much on us. And that has been really great. If someone was watching this and wondering whether they should partake in our program, which is called Spensuasion, as you might recall, what sort of comments would they say to you if you were to bump into them and say, hey, what, you know, I heard you did this course. What should I do? Should I do it? Should I not? What would be some comments or feedback that you would say to them?
Well, firstly, I'm always one that's keen to always learn new things. I find that we can always learn from all aspects and apply it to our job or even in our personal life, which we joked about, I think, on the first day that you were here.
Yes.
I found it quite helpful in that it's kind of helped kind of what I've already known, but extend my knowledge in order to try and help me be a better therapist, I guess.
Communication. Yeah, that's the key, isn't it?
Yeah, and ordering for me to give a better service to my patient.
Yeah. And I know there's many people out there who also have that same yearning to give that better client experience, you know, to give that better communication and really listen to what someone's saying rather than backing away. You know, I must admit, I've been very impressed with the outcomes that you've achieved. So congratulations. Well done. You've done a great job.
Thank you. No, it's been good fun.
Yes, we did manage to have a bit of fun along the way as well, didn't we?
We did.
Had some good laughs, and that's what it's all about as well. So thank you. Thank you very much for taking a few minutes out of your time to share that with us. I know that there's many people out there that will benefit from your few words of wisdom there, Jahni. So thank you very much.
That's all right. Thank you for your knowledge.
That's a pleasure. My pleasure. All the best. Thanks again.
Thank you.